I'd like to call on Dr. Mary Assunta to share her insights on the Philippine performance and participation in COP 1 to 10. I can't believe it. No, you were actually present, physically present from 1 to 10. Wow.
Yes.
So kindly give us
Except for COP 2.
except for 1. Okay. Too bad. But anyway, you can report on 1 and then 3 to 10. The floor is yours, Doctora.
Thank you, Madam Chair. My name is Mary Assunta Kolandai, and I'm the Senior Policy Advisor for the Southeast Asia Tobacco Control Alliance and the Head of Research and Advocacy for the Global Center for Good Governance in Tobacco Control. So as part of the international community, I have followed the negotiation sessions of the WHO FCTC and have attended nearly all of the sessions from COP 1 to COP 10, except for COP 2. And this is as an observer, NGO observer. Over the years, I've observed the Philippines go from being a champion country for tobacco control that raised the bar. For example, at COP 5, the Philippines received an orchid for excluding the National Tobacco Administration as a sign of implementing Article 5.3 of the WHO FCTC, to now one that is taking weaker positions or positions more aligned with countries that are either non-parties to the FCTC or those that support the tobacco industry. This is seen especially over the past 3 COP sessions, and this also coincides with an observation that when the Department of Health was not the head of delegation at COP 8, COP 9, and COP 10. And this is to negotiate at a health treaty. Having monitored the tobacco industry for over 3 decades, I can identify industry buzzwords and phrases. One such term often used by the industry is taking a balanced approach. And in reality, there can be no balanced approach in tobacco control. You either protect public health or the tobacco industry. When you look at the balance sheet, the cost of tobacco to health and society far outweighs the benefits that the tobacco industry claims it provides. This balance sheet cannot balance. It was surprising for the international observers at COP 10 to hear the Philippines delegation refer to RA 11900, the vape law that had lowered the purchase age and allowed online advertising, as a landmark legislation with new safeguards. What actually is best practice in safeguarding children and youth from new tobacco products? About 40 countries around the world, including 5 in the ASEAN region, have taken a precautionary approach and banned vape products to safeguard children and youth as part of comprehensive tobacco control. The fact that more Filipino children are now vaping can only mean that they are not being safeguarded. Other countries that have allowed sales of vapes, such as the UK, Indonesia, Malaysia, they are now facing a big problem with children vaping. In Australia, vape products can only be sold by prescription, flavors are banned, and disposable vapes are banned. The tobacco and nicotine industry has framed e-cigarettes as the less harmful alternative to cigarettes and a good investment for the country. And this is a persuasive argument that has been bought by trade and investment officials. However, more evidence is now emerging on the many harms of vaping, primarily injuries to lungs and the heart. And the latest research shows e-cigarettes users had changes to their DNA in their cheek cells, similar to those of smokers. Tobacco companies have persuaded many governments, including policymakers in the Philippines government, that they are phasing out cigarettes because smoking is harmful, and that regulators should allow so-called less harmful alternatives, such as e-cigarettes and heated tobacco products. The main beneficiaries of this approach to tobacco control are the tobacco and vaping industry, because now the industry provides more choices of addictive products to youth. Riding along the streets of Manila this past few days, I am shocked to see so many sari stores painted with the red and white of the Marlboro chevron. This is a relaunch of the Marlboro cigarette advertising that is visible to children. And this is the same company that is claiming it is going smoke-free. WHO FCTC Article 5.3 calls on governments to protect public health policies from commercial and other vested interests of the tobacco industry and those who further its interests. The Philippines is internationally renowned for its 2010 landmark measures that implement this important provision of the WHO FCTC. As countries prepare for COP11 in 2025, we can expect the tobacco industry lobbying to intensify. E-cigarettes will continue to be a hot topic, and the COP process has a mechanism for transparency to protect public health. I urge the Philippines government to COP11 to, number one, exclude agencies that protect and promote the tobacco industry. 2, to declare conflict of interest. And 3, when you go to the COP11, to do your utmost to protect children and youth from all forms of tobacco use. Thank you, Madam Chair.
Thank you so much, Dr. Assunta. We appreciate your insight and your observations.